who knows, next time you might be the person who is lying there. And I'm sure you'll want somebody who is doing this job for the right reasons to be taken care of.
We touch, we break, make it seem like we feel the same. We love what we hate. We lie, but we know we can't wire what doesn't.
Hello beautifuls, how are you doing today? Welcome to Video Nyando's Tech again. If you're new, umekaribishwa sana. To the return subscribers, thank you for joining me again. I do appreciate that. Now, last time I talked about the challenges that I had studying nursing in Germany. So today I'm going to talk about some of the qualities you need to have in order to be a nurse. Or let me put it this way: if you have these qualities, you might make a good nurse. Genau, let's put it that way. Genau. Number one, are you good with customer service? Because nursing is actually customer service. What you're doing is serving the patient. Somebody's put it very well, very nicely. Nursing is a life of service. You're actually serving people. Don't go to nursing because of the money. Don't go to nursing because of the praises you might get. Don't go to nursing because of the status. Because the amount of work that nurses do is so much compared to amount of pay that they are getting. That is a fact anywhere, ever in the world. So nursing is actually customer service. And if you're not good with customer service, because you're going to have to do a lot of explanation and a lot of talking and a lot of pampering patients, what is this one? Ange. Let me put it up there. I'll look for the English word later. You're going to have a lot of knowing how to find a way of talking to some doctors who are really hard to get through, because at the end of it, I'm the one who is at the bedside of the patient. I'm the one who knows the patient much better than the doctor knows. So sometimes you talk to the doctor, but there are these doctors who feel like, I am the doctor, I know everything. So you really have to know how to talk to a doctor to get to see your point of view about these patients. Sometimes some doctors are just, yeah, that's them. So there is a lot of customer service in nursing. If you're not a customer service person, just don't do it. Number two, can you handle stress? Because trust me, nursing can be really stressful. There are sometimes you come back home, you just want to shower and disappear. You don't want to talk to anybody, you don't want to see anybody, because there are some days that are really crappy. You need to be somebody who can really handle, who can be in a position to handle stress, because there are some days where there is one emergency after the other, or the things are just running wrong. There are some days you come to work and you're asking yourself, what did this poor take for lunch today? Or like, why is everyone cooks today? There are some days that are just stressful, and you need to be a really quick thinker. You need to be a critical thinker. You need to be somebody who can make decisions really fast and change your plans according to the situation. You really need to be a quick thinker, because if you're not somebody who can really think quick, it can be actually lebensgefährlich. It can be dangerous to the patient. Sorry, the words that disappeared from my mouth. Like, you really need to be in a position to think fast, yeah, to make decisions fast, because there are some situations that are life and death, and they need you to be on your toes and be able to think fast. Or you come to work one day and you were supposed to be 2 or 3 people in teams, and 2 people have decided to be sick, and you're finding yourself there alone. You have to be in a position to reorganize your day. I mean, you really have to be on your toes. When you leave your place going to work, expect anything. Just go there and ask yourself, so which bomb exploded today? I always say, I go to work every day expecting the worst, but hoping for the best. That way I'm not surprised by anything, or I'm not caught off guard with anything. Like, yeah. Number 3 for me would be, you need to be somebody who can work with a team. In nursing is about teamwork. You can't do this job alone. You need your colleagues. You need every single person that works in this institution. You need to work with your fellow nurses. You need to work with doctors. You need to work with the administrators. You need to work with the what's this called, Putzfrau, the cleaners. You need to work with the people, the Hausmeister. Write that up there. You need to work with therapists. You need to work with the word that still refused to enter my head, Ange, like I put it up there before. You need to be in a position to work with people around you, because this job you can't do it on your own. You need support from each and every person. So you really need to be somebody who can work in a team. If you're this kind of people who just want to work alone and you want to be on your own space, nursing is not for you. In which number was I? I don't know. It doesn't matter. Oh, I don't know how people sit twisting their legs. I can't do that. So the next thing in nursing, you need to have a thick skin, because some of these patients can really get in your nerves. They can really get in your nerves. Sometimes they get in your nerves because, I look at it this way, sometimes, not always, sometimes they can be really rude because they are releasing their stress on you. I'll have to use Dutch. Die kommen nicht klar mit der Diagnose, was die haben. Put it up there. Die kommen nicht klar mit der Diagnose, was die haben. Die kommen nicht klar mit der Situation in ihr Leben im Moment. And in order to get rid of all this stress and everything that's happening wrong in their life, they just look for someone to throw that. And since you're the person who is there, it comes to you. So you really have to have a thick skin. Sometimes it's not just the patient, sometimes it's the relatives. Oh, how I've looked for this name. Sometimes it's the relatives of the patients. They can really get in your nerves. Sometimes it's the doctor who messed up somewhere and they're looking for someone just to throw the blame, or the doctor who's not listening to your point of view, although you know this patient much better than the doctor knows, or a therapist who's just having a bad day, but they found somebody to throw their stress on. You really have to have thick skin in this job. But on the other hand, you shouldn't just let every crap come your way and you just take any shit that comes your way. There's sometimes where you have to say, hello, yes, it's good, and really be professional about your work. Put your feelings away and just say, you know what, Leo, now we're going to talk like professionals. You do your part, I'll do my part. Otherwise, you'll be coming home every day just crying yourself to sleep, because some days, to be a nurse, you also need to have empathy. You need to be somebody who is empathetic. You need to be somebody who is very patient, because it needs a lot of patience. It needs a lot of patience. There are some patients who you really have to hold yourself together in order not to explode before them. Because there's some patients, there's some relatives, there's some doctors who really test your patience. You need to be somebody who is patient. You need to be somebody who is empathetic and in a position to feel somebody's pain, to understand somebody else's point of view. You need to be this kind of person who can get themselves in somebody's shoe or understand somebody else's shoe. It's not for everybody, but if you have that, you could make a good nurse. Last but not least, you need to be a very organized human being, because especially if you're a leader and you're chaotic, your whole team will be chaotic. if you start your job without a plan, just like in life, you will be writing like a chicken without the head, left, right, center, grabbing everything everywhere, running up and down the whole time, but doing a lot of nothing. So you really need to be somebody who is organized. Have a plan for your day. Of course, it's inevitable that things you'll have emergencies here and there, but at least you have a plan, and in your plan you have time set for emergencies where you know something can come in between, but you do have a plan for the day. Because if you don't have a plan, if you're not organized, my friend, you'll come home every day, and every single day you will have a terrible headache. Every time you go to work, you'll be panicking, because if you're not organized, your days will be nothing but chaos. Well, I hope for somebody who was planning to go to nursing just because of the money, you put a break on that, because our patients need people who can really take care of them, and not somebody who's just going to work because of money. I've worked with some people who really just took this job because of the money, and if you see the way they treat the patients, you're like, why exactly are you here again? So if you're not somebody who is empathetic, if you're not somebody who's patient, if you're not somebody who can handle stress, if you're not somebody who really is there to serve other people, just step on the side, and please let the people who can do this job take the job and take care of other people who need our help out there. Who knows, next time you might be the person who is laying there, and I'm sure you'll want somebody who is doing this job for the right reasons to be taking care of you, and not just somebody who's there thinking, yeah, after all, I'm just here to earn my money, so I don't care what happens to you, right? Okay, until next time, have a blessed day, have a good day, and I will see you in my next